Hi, today I'm going to be demonstrating, I'm going to be verbalizing trach suctioning, then I'm going to demonstrate trach cleaning. So the first thing I'm going to do is I'm going to compare my MAR with my doctor's order. My MAR states she wonder, it corresponds, date of birth is 7/15/19XX. It corresponds, the date XXXX 2020, no known allergy, time 800. Physician order states that tracheostomy care Tuesday, Thursday, and Saturday using normal saline. Then suction to bedside and suction tracheostomy as needed. So everything tallies, everything matches. The next thing I'm going to do is I'm going to pull out my supplies. So as I'm pulling out my supplies, I'm going to be checking for expiration date. I'm going to be checking to see if anything is broken. I'm going to be checking to see if any of my supplies are open. So right now I have an extra, sterile gloves that I'm going to be using, because the one that comes with the trach kit doesn't fit my size. It's too small. So I have a sterile gloves which is not open, it is intact. I have my suction catheter kit, it is not open. I have the drain sponge, the surgical sponge, they are not expired, they are not open. I have my trach cleaning tracheostomy clean and care tray. I have my trash. I have my gloves. I have my normal saline, and I have my goggle. So this goggle, I'm working with a patient, actual patient. I'm going to be wearing it to protect my face, but for demonstration purposes, I'm not going to be using it. So now that I have all my supplies here, the next thing I'm going to do is and none is expired, I'm going to proceed to my patient's room. Hi, my name is Ololade. I'm going to be your student nurse for today. Can you go ahead and tell me your name and your birthday? Chiwander 7/15/19XX. Okay. Alright, so my patient, she told me her name and her birthday. Two forms of identifier. I'm going to use it to compare with our wristband to see that I'm not in a wrong patient's room. Okay, it tallies. So do you have any known allergy, ma'am? No. Okay, so what I'm here is your doctor ordered your tracheostomy suctioning and cleaning to avoid, to prevent infection. Do you have any question? Okay, I see that you cannot talk, So I'm gonna give you a board with a marker. If you want to communicate with me, you can write whatever you want to ask now. And if you're unable to write, you can signal with your hand, okay? Any questions? All right. So right now I've checked my patient. My patient is okay. No questions. I've explained to my patient. I'm going to provide for privacy now. I'm going to wash my hands. I've performed my hygiene. I'm going to wear my gloves. So after I've wear my gloves, I'm going to pull the rail down, and I'll make sure that the bed is in a working position for me. My patient is going to be sitting in eye Fowler position. So my patient is going to be sitting in eye Fowler position. And the next thing I'm going to do is I'm going to check the suctioning machine to see that the pressure is set at 100 to 120 millimeter of mercury. That is done. I'm going to go ahead and check the oxygen flow meter. That one too is good. And the next thing I'm going to do is I'm going to go ahead and perform vital signs on my patient. I'm going to check my patient's vital signs. So especially the pulse oximeter. I'm going to be using the pulse oximeter to check my patient's CO2. Okay, now that I've checked everything is accurate, my patient is sitting in a high Fowler position, vital signs are good, are accurate, my patient is looking good. Okay, so that is noted. The next thing I'm going to do is I'm going to go ahead. When I'm doing the suctioning, I will make sure that I do not suction for more than 10 seconds. I will make sure that my suctioning is not more than 10 seconds. I'm not going to prolong the suctioning because I don't want to cause, injury to my patient. So the suctioning is not going to be more than 10 seconds. And before I start the suctioning, I'm going to I'm going to hyper oxygenate my patients. I'm going to hyper oxygenate my patients, and it's going to be between 5 to 6 breaths over 30 seconds. 5 to 6 breaths over 30 seconds. So I've done that. I'm going to go ahead now and remove my gloves and perform hand hygiene. I've done that. The next thing I'm going to be doing now is I'm going to open my normal saline. I'm going to take my suctioning catheter kit. Inside the suctioning catheter kit, I have the suction catheter, I have the vein gloves, I have the pop-up cup. So I'm going to open it. I'll bring out the pop-up cup. Inside the pop-up cup is sterile, so I'm going to be mindful and I'm not going to use it. I will set it down. I will open my normal saline. I will pour some inside the pop-up cup. Then I will wear my gloves, my sterile gloves. Now my hands are sterile. This is going to be my left hand is going to be my dirty hand, and my right hand is going to be my clean hand, my sterile hand. So both hands now are sterile. So the next thing I'm going to do is I'm going to go ahead and take out the suction catheter with my dirty hand. I will connect it with the suctioning machine. Like I said, when I'm suctioning, I'm going to suction intermittently, and I'm not going to suction for more. I'm not going to suction for more than. I'm going to suction for 10 seconds. I'm not going to suction for over 10 seconds. My suctioning is not going to be more than 10 seconds when I'm suctioning. So now that I want to suction, I'm going to go ahead. This hand is the dirty hand. I'm going to use my clean hand. I'm going to use my clean hand and grab the tip of the catheter, which is sterile. I will dip it inside the box, inside the pop-up cup, and I will suction it to check if it is suctioning. Now it is suctioning. Then I will go over to my patient. I will insert the catheter inside the trach and let it go down. So when it reaches a level of resistance that it cannot go on further, I will begin to suction. So when I'm suctioning, I'm going to be suctioning intermittently. Then when I'm I'm going to suction slowly. Then I will slowly pull out the catheter and suction, and put my catheter side by side to suction the side. As I'm pulling it up, I'm suctioning slowly. I'm suctioning the side slowly. So when I'm done, if I see that there's still more things to suction, I will dip it inside the box, the pop-up box, inside the normal saline, and I will suction it, and I will repeat it again. But now my patient is good, so my suction is good too. So I'm going to roll the catheter in my hand, and I will remove my gloves, and I will trash it. I'll perform hand hygiene, and that is the end of my suctioning. So the next thing I'm going to do is I'm going to do the cleaning. Like I said earlier, that my cleaning, I'm going to be using these gloves, because the gloves that comes with the catheter with the tracheostomy clean and care tray, it is small. It did not fit my hand when I initially wanted to do the video. So I'm going to be using this. So now I have this. It is not open. It is not expired, and my tray clean and care tray too is not expired. So I've washed my hand. The next thing I'm gonna do is I'm gonna wear my gloves. I'll wear my gloves. Then I will go over to my patient and remove the dressing. When I remove the dressing, I'm going to be checking for the contents in the dressing, the amount of the exudate, because I have to, document it. Then I will roll it in my hand. I will trash it. I will perform hand hygiene. I'll wash my hands. So now that I've done that, the next thing I'm going to do is I'm going to go ahead and I've performed hand hygiene. I'm going to go ahead and open my Trach Clean Care Tray. Everything inside is sterile. So I'm going to open it from the outside and put it down here. So I'm going to take the trach, I'm going to take the pad. I'm going to see the shining side is going to be facing down. The edges are non-sterile. Okay, so the shiny parts is going to be facing down. So now that I have that, meanwhile, I'm going to open my normal ceiling. I'm going to open it down. So now that I have that, like I said, I'm going to trash this because it doesn't fit my hand. So I'm going to bring out the sterile gloves that I want to use. This is going to be my dirty hand again, and this is going to be my clean hand. So I'm going to adjust it when I wear that. So now my hand is sterile. I'm going to use the sterile hand to take everything inside and put it there, sterile to sterile. I don't need this, so I'm going to just trash it. I'm going to need all this. So the next thing I'm going to do is I'm going to use my non-sterile hand now, and I'm going to pour the saline inside each compartment. I will sit it down. Now I'm going to use this hand to take my glove. now I can adjust the gloves because it is sterile to sterile. I've not broken any sterility now. So it is sterile to sterile. So now both hands are sterile, but this is going to be my dirty hand and this is going to be my clean hand. So now that I have everything set, the next thing I'm going to do is I'm going to go over and bring out the trach so that I can clean it. I'm going to dip it, soak it for a few minutes inside one of the compartments with my dirty hand. After it has soaked, I'm going to heat it so that whatever is inside can come out. Then I will use one of the, this is my clean hand, I will use one of the Q-tip. I will dip it inside the other compartment. I will wash, put it inside, wash. Put it inside, wash. I will trash it. I will take another one, sterile to sterile. Oh, that is gone anyway. So sterile to sterile. I will dip it again inside the wall, inside the normal saline. I will wash, clean. Then I will trash it. Then I will take one of the gauze. I will dip it inside the normal saline. I will clean the outside. I will trash. Then I will take another gauze. I will take another gauze. Then I will use it to dry the trach. I will trash. My hand is still sterile. Then I will go ahead and insert it into the trach. My hand is still sterile. I'm just going to hold it because it's moving. So yeah, so my hand is still sterile. I've inserted it, so everything is going on good now. So the next thing I'm going to do is I'm going to use one of the Q-tip. I'm going to use it, dip it inside the normal saline, the third compartment. I will use it to clean outside, clean. After I finish cleaning, I will trash it. I will take another one, dip it inside the normal saline. I will clean again, clean. See that it is clean. I will trash it. This hand is still sterile. This is the hand that is not sterile. So because I need another gauze. So I'm going to take another gauze. This hand is still sterile. So I have my other gauze here. This hand is the dirty hand. I think I broke sterility that time. I supposed to have opened it and put it here. I thought the gauze inside the pack is going to be enough. So I will put it there. So I'm going to assume that it is sterile. So I'm going to take it and use this to clean Clean, 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 clean. So everything is clean. I will trash it. So right now, the next thing I'm going to do is I'm going to go ahead and wear my patient a new dressing. So right now, nothing is sterile. Sterile parts is, I'm gonna put this one, but I need to pull the thing down so that I can wear it. I need to put the head down so that I can wear it. I cannot I can't wear it like that. Sorry. So I'm gonna go ahead and wear it. I just want to show the camera. I've worn it. It's looking good. My patient is still in high Fowler position. So right now, my hands are not sterile. Everything is good. So the next thing I'm going to do is I'm going to go ahead and I'm going to go ahead and change the trach tie. But I'm not going to be changing the trach tie because I don't have another trach tie. So I'm going to assume that I change the trach tie. After I finish checking the trach tie, when I'm putting on the trach tie, I'm going to use 2 fingers. I will insert the 2 fingers underneath the trach tie to feel that it is not too tight for my patient. So I'm going to use 2 fingers to feel it so that it is not too tight on my patient's throat. I don't want to choke my patient. So that is that. Then the next thing I'm going to do is I'm going to remove this trash, perform hand hygiene, wash my hands. I will take another gloves because I want to clean my mess. I will take another gloves. I'll wear another gloves. So after I finish wearing another gloves, I'm going to pack my mess. My patient is still sitting in a high Fowler position. Everything is looking good. I'm observing my patient. So I'm going to pull the rail up and bring the bed down to a minimal position. And I'm going to ask my patient, do you have any questions? No question? Okay. So I will give my patient call light. I will make sure my patient is comfortable. I will put my patient's belongings close to her, like water and telephone. I will make sure it's close to her. Then she has no questions. Okay, Ms. Wanda, I'll be back in 30 minutes to see how you're doing, okay? But if you need me before then, just use the call light, okay? And whatever you want to communicate, please write it on the board, okay? All right. So that is, then I will remove my gloves, wash my hands, and that is the end of my presentation. Then I will document as per facility protocol. I will document the vital signs that I get. I will document the escudate that I found there, the color, the quantity. I will document the suction, the quantity and the suctioning cup. I will document how my patient tolerate the suctioning per facility protocol. Thank you, and that's the end of it. Thanks.